think I actually did promise someone that it would be recorded as well. So that's, I think you've saved me some embarrassment as well. Fantastic. Well, I thought I'd begin by giving a bit of an explanation for what epistemic trust is, what it means. It sounds very technical as a term, and I think that's one of the challenges with it. And so I just wanted to bring a very brief introduction before we get into what our different approaches are as part of our PhD research projects. So broadly, epistemic trust is kind of defined as a kind of trust, which doesn't do a huge amount of good, but it gives us a starting point. So epistemic trust is a specific kind of trust in information that's communicated from the social world. And specifically, it's the kind of capacity to consider knowledge communicated by other people from the social world as significant, relevant to the self, and generalizable to other contexts. And that's a very kind of dictionary definition. And what we'll hopefully start to do when we elaborate on what our projects have explored is what that looks like in practice, especially what that looks like in terms of items that might be used to measure epistemic trust, but also what it looks like in terms of the experience of trusting in other people and the information that they share with us. And this idea has a long history in philosophy and epistemology, but it's only recently been brought into the kind of developmental psychology literature by a group of theorists who Eva, Elizabeth, and I are all associated with at the Anna Freud Centre and the Psychoanalysis Unit at UCL in London. And they're really trying to build this idea that epistemic trust and mistrust are key capacities that are developed early in life and enable us to feel connected into a social world. They enable us to use other people's testimony to learn about the world rather than having to have empirical evidence of reality for ourselves. We can rely on what other people say. It's an essential part of teaching, but also in the recent developmental literature, is proposed to be a crucial part of developing a sense of self and other, and that kind of integrity of the self is such an important part of mental well-being across the lifespan. So as I've kind of mentioned here, the idea of epistemic trust is that it's a natural and evolutionarily adaptive process. It's a mechanism that all children gain the ability to trust adults in their social world if they have appropriate caregiving environments in that early stage, which are responsive, which are able to meet their needs, and ultimately which are trustworthy. So children are set up to naturally be able to discriminate between reliable and unreliable sources of information, but we do require the right kinds of experience to maximize that capacity. And it's theorized that in traumatic, frightening, or inconsistent caregiving environments, children don't develop that capacity in the way that they are evolutionarily set up to. So children who experience those really inconsistent or frightening environments, which have been associated with all kinds of negative outcomes of other kinds, may experience a form of epistemic mistrust, or they may go almost the other way and experience a kind of credulity, a complete inability to discriminate between different sources of knowledge. So taking all sources of knowledge from the social world on board and not being able to kind of fairly justify which ones are trustworthy or not trustworthy. So those put people at risk of a range of potential outcomes. And one of the key ones that's been theorized and really part of the root of bringing epistemic trust into the psychological literature was as an explanation for severe psychopathology. So people who present with a really severe kind of persistent distress, which has traditionally been called borderline personality disorder, do sometimes present with forms of that very either mistrusting approach, which can be almost petrifying, that sense that they are completely unable to shape a belief that no one in their social world is trustworthy. And that can really isolate people. And that can also inhibit their ability to respond to therapeutic treatment. And in exactly the same way, some people who have those kind of borderline personality disorder diagnoses are incredibly credulous within the social world, which produces other forms of vulnerability, but also may mean that they don't understand when a relationship might have special qualities to it, that might have helping qualities to it. They might see all relationships in their lives as essentially on an equal footing and all information as essentially equal in value. So it has really important potential mental health implications. And it's been proposed that can then be expanded from that very severe end of a psychopathology spectrum to also explain other forms of mental distress. And there was even one paper by Peter Fonagy and Chloe Campbell, two of the authors involved in the paper that we're going to talk about today, which proposed it as a transdiagnostic mechanism for all kinds of mental health difficulties, as a kind of common P factor that could explain all psychopathological difficulties, which might be a bit of an overextension of the concept, but it does suggest that this is potentially a really interesting area to start exploring in a bit more depth. And just finally, I think obviously with a bit of relevance to the work that the Society for Psychotherapy Research does, is that it's proposed that the recovery of epistemic trust in psychotherapeutic treatment could be a really key mechanism or predictor, or at very least context, which helps to open a person who's in a psychotherapeutic relationship to the idea that the therapist may be able to help them, even may be able to mentalize, understand their mind and understand their perspective with greater clarity if they are able to invest that trust in that relationship. So potentially this has real clinical implications, both from an etiology perspective, but also from a treatment perspective. So that's a real whistle-stop tour. I've managed to try to condense quite a lot of work into just one slide, but I want to just set us up to think about some of these key areas of ambiguity, because it still is a concept that's under development. And I think all of our work, which we'll very briefly summarize, really does speak to the fact that there are lots of different ways of understanding this concept, lots of different ways of applying it. And the paper that we'll talk about in a moment really does address one approach, but I think most of us have chosen to take different versions of epistemic trust. And so we really want to think about expanding, varying the perspectives that we can use when we think about what it means to talk about epistemic trust. And so these are kind of some of the issues that I think would be good for us to be holding in mind whilst we're listening today. One major area of contention, I think, is whether epistemic trust is a trait, a state, the kind of fudge that's been used, which is a stance, or a dyadic process. So are we in one relationship able to have epistemic trust with one person? Is it almost a dispositional characteristic? Is it something that we enter into and out of according to certain triggers? Or is it something that's so consistently relational within a given dynamic that you might have a consistently epistemic trusting relationship with one person across time, but that might fluctuate in its more qualitative dynamics? So that's, I think, a really important area, and one that will probably be recurring as we think about this paper and our work. But there are also some other issues, whether it's a bipolar spectrum between credulity and mistrust, or whether it's possible to be both credulous and mistrustful. And so it's therefore a bit of a more multi-dimensional construct. There's also some of the key issues that I know several of us are really interested in terms of the developmental side of the theory, which is about recovery from an epistemic mistrusting stance, whether it's possible to recover that initial damage that's done in those inconsistent caregiving relationships, or which are produced by relationship disruption in childhood, whether it's possible to eventually develop a stance of epistemic trust, having had that really unadvantageous original kind of situation. Then there are a couple of other key issues which I think really surround its psychotherapeutic role. And there is increasing theory that suggests that epistemic trust might be a really key thing to have in mind as part of a treatment dynamic. Building that ability to open yourselves to communication, open yourselves to receptiveness, is proposed to be a really crucial aspect of the therapeutic alliance. I know that was one of the things talked about in our last journal club, but it could be a really interesting area to start exploring. I know that Elizabeth's work will touch on that when we get onto that. So that's it from me as an incredibly whistle-stop introduction. But I'm going to hand over to Elizabeth, who's going to talk a little bit about the paper that we sent around as a kind of topic setting for this area. And Elizabeth's one of the co-authors on this paper, so has some insight into what it's all about.
Thank you. Lisa, may I share my screen from this end? So if you, thank you. It's also good for me to calculate the time. Okay, so today we will start with this paper led by Dr. Chloe Campbell at UCL to discuss the conceptualization and measurement of epistemic trust, mistrust, and credibility. So following this, myself, Eva, Asa, and Jerry will each introduce our work related to epistemic trust. So most of you have already read this paper, I assume. So it's clearly that this study followed a typical procedure to develop and validate a new scale. As we only have 10 minutes here for this paper, I will just briefly introduce what is achieved in this study in order to start our discussion today. So to start with, Asa has already given an introduction of the terms and the background. So very quickly, epistemic trust is a capacity to selectively and appropriately attend to information for social learning. From a developmental perspective, it's believed that ostensive cues from caregivers can facilitate efficient learning of interpersonally transmitted knowledge, leading the individual to encode what they're being told as relevant, generalizable, and therefore should be internalized. So typical examples of ostensive cues are smiling face, eye contact, and accurate turn-taking. All these are commonly seen in normal, healthy parent-infant interactions, and this is how individuals develop a stance of epistemic trust, so that we can say, in a simplified way, that parental mentalizing facilitates one's development of epistemic trust. However, those with early adversity often lack such experience and therefore tend to take a stance of epistemic mistrust or credulity. So those with epistemic mistrust often show a tendency to treat any source of information as unreliable and ill-intentioned, so that they reject or avoid allowing themselves being influenced by communication from others. And those with epistemic credulity, by contrast, display a pronounced lack of vigilance in interpersonal transactions, which signals a general lack of clarity about their position and result in vulnerability to misinformation and a potential risk of exploitation. So now that we have repeated what these concepts are, how can they be measured? To briefly introduce, the ETMCQ and its relations to relevant factors were examined in 2 studies on Prolific, which is an online survey platform. Study 1 had 500 samples, study 2 had over 700 samples. They're all community, so non-clinical adults in the UK. Both studies yielded 3 correlated yet distinct factors: trust, mistrust, and credulity. And they confirmed the reliability and validity of the ETMCQ in both studies. After all the analysis, the original 18 items were cut down to 15 items, and each subscale consists of 5 items. Let's now take a look at the questionnaire items. Here I'm only giving examples for each subscale, but ETMCQ is open to access. So please feel free to download that scale with the paper. It's in the supplementary material. So for epistemic trust, an example item is, I usually ask people for advice when I have a personal problem. For epistemic mistrust, an example item is, if you put too much faith in what people tell you, you're likely to get hurt. For epistemic credulity, an example item is, in the past, I have misjudged who to believe and been taken advantage of. Participants were asked to rate on a 7-point Likert scale from strongly disagree to strongly agree. So as mentioned, the 2 studies have also been examined they have also examined the ETMCQ with theoretically relevant factors. It was found that mistrust and credulity were positively associated with childhood adversity, mental disorders, difficulties in understanding mental states, and insecure attachment styles. Mistrust and credulity also both partially mediate the link between early adversity and mental health symptoms. It's worth noting that epistemic trust was not associated with reduced level of mental health symptoms and did not moderate, in fact, the impact of childhood adversity. This is because epistemic trust is likely to be a default mode of social functioning, and in that sense, a somewhat neutral value. These two studies were conducted in non-clinical samples. So what kind of role epistemic trust plays in clinical samples needs further exploration. Regardless, as Asa mentioned, reduction of mistrust and credulity may be crucial common factors in promoting resilience and effective psychotherapeutic interventions, but we do need more research to examine that, and that's what we did. Above is all about the paper. Thank you for listening. I think now I should just proceed to introduce my own research. Yeah, straight away.
Yeah, fantastic. Yeah.
Okay, thank you. I know I only have 5 minutes for this. So my PhD research looks into epistemic trust, mistrust in social cognition, psychopathology, and psychotherapy, and adopts experimental, quantitative, and qualitative research methods. Today, I'm mainly going to introduce my work that explores epistemic trust and mistrust in psychotherapy using the IMPACT data, which is an RCT comparing 3 interventions: CBT, short-term psychodynamic psychotherapy, and brief psychosocial intervention in the treatment of depression for adolescents. I'll be speaking many details because time, but please send me emails if you want to know more about it. So there are 2 qualitative studies conducted to explore epistemic trust and mistrust in psychotherapy for depressed adolescents. Study 1 sought to understand depressed adolescents' subjective perspectives and experience of treatment through the lens of epistemic trust. So we created a typology of different journeys they went through the course of psychotherapy, starting from epistemic mistrust and over a 2-year period. So what we did is we first identified 15 out of 46 adolescents who entered the treatment with indications of epistemic mistrust using the baseline interview with them. Then we mapped the different journeys each of the 15 adolescents went through using the interview at 3 time points, baseline, at the end of the treatment, and 1-year follow-up using ideal type analysis. We eventually formed 3 distinct journeys of adolescents' experience in relation to epistemic trust and mistrust. Then proceeded to study 2. So out of the 15 adolescents in study 1, we purposively selected 6 adolescents based on their treatment outcomes, and we used task analysis to build a synthesized rational empirical model of how epistemic mistrust is resolved in psychotherapy. I'd love to give more details about these 2 studies, but I'm mindful of the time. I'm now going to share how we conceptualize and measure epistemic trust and mistrust in the 2 studies. So how did we conceptualize and operationalize epistemic trust and mistrust in psychotherapy? We developed an index of indications of epistemic trust and mistrust based on Fonagy and colleagues' work. It is our belief that those who take a stance of epistemic trust should expect information communicated from others to be relevant and useful. Meanwhile, selectively attending to new information. They also have a trait-like tendency to trust others, but meanwhile are able to experience interpersonal relationships differently and show a flexibility in their mental states and social communication. By contrast, those who take a stance of epistemic mistrust often expect information from others to be irrelevant, useless, or ill-intentioned. They are unwilling to receive information from others, shown as avoidance or rejection of social interactions. They have a trait-like tendency to experience social interactions as rigidly negative, in a rigid negative way, basically. And they lack the capacity to revise their interpretations of relationships. I know this all sounded familiar. This was developed while the paper earlier we mentioned was published. And I know these items are quite abstract and all top-down descriptions. But if we link them to what adolescents actually said in the interview and in psychotherapy sessions, it's actually not too difficult to identify those who are with epistemic trust and mistrust. So I have prepared 2 examples, but we will only have a look at one of them because of time. So Rachel. So Rachel said at the baseline interview, she said, I'm really sensitive. I don't like people, like cutting myself off from everything. But it's like gradually snowballed. Like suddenly I couldn't stand the company. Like I'd be paranoid. Like it would seem like everyone was against me and that I was alone. The more you isolate yourself, the more you cannot be around people. And it's like this sort of vicious cycle. This is a very good example for us because we can clearly see that Rachel avoided social interactions because she believed that people are ill-intentioned and she could not benefit from social communications. She mentioned the word paranoid, which is a quite explicit word for mistrust. Overall, we can see that Rachel cannot trust others as a source of knowledge and thus has a difficulty to learn from social environment. However, there's a shift happening from mistrust to trust because of the therapy. So at the end of treatment, in the interview, Rachel said, I realized that if I was willing to communicate, then they do whatever they could to help me. And then you realize this is actually helpful. And in 1 year follow-up, Rachel said in the interview, I'd like to know about humans as a collective and like the world as a whole, rather than just like a sort of, one-dimensional view of myself. It's clear that Rachel expressed her expectation that information communicated by others can be relevant and useful, and she gradually formed a trade-like tendency to trust others and confidence in interpersonal relationships. She's open to learn new knowledge and different perspectives from others and about others. So we have another example about Nathan. There was no shift in his case, but we're running out of time. So as you can see from the quotes from Rachel, we only identified adolescents who demonstrated explicit indications of epistemic mistrust. I believe there are individuals who are also taking a stance of epistemic mistrust, but rather having it in an implicit, elusive way that we cannot tell immediately. They may be attending social events regularly and form superficial connections with people, but they lack the capacity, or more importantly, the intention for social communication flexibility. Regardless, in our samples, like Rachel, cutting themselves off from everything and hiding from social interactions are quite visible signs of epistemic mistrust, as they consider social interactions useless and or harmful. So this is all about my research. Eva will be the next to introduce her brilliant recent publication on this topic. Thank you.
Fantastic. Thank you so much, Elizabeth. I will reshare the other slideshow we have going on. There we go. Can you all see that again? Is that back?
Yeah, I can see that. So hi, I'm Eva. Thanks so much for having me at this journal club. Such an exciting topic to talk about. I'm going to be just very brief, and I'm going to talk about this study, which we published this year in Qualitative Research in Psychology. You can see Elizabeth's a co-author of mine, and we really enjoy sort of cross-pollination on thinking about epistemic trust. And yes, I'll be very brief, but please do tweet at me or email me if you have any follow-up questions. Next slide, please. So I guess I just wanted to position this paper, and really that's almost all I'm going to do. I'm not really going to go into the findings a great deal, but I just think it's such an interesting time in the journey of epistemic trust theory. The Campbell paper, which we've read for today and that Elizabeth presented so well, is really a heuristic approach to looking at this theory, looking at how do we generate these rules of thumb, this quite universal theory, as Asa said, a theory which has been a possible explanation for all psychopathology. And how do we apply this really very this theory which is meant to be independent of context. It works in any relationship, in any therapy, in any developmental setting. And I was quite interested in how do we take that quite big theory and bring that down to a very context specific level, one relationship, and how do we understand how epistemic trust works really in a live way. I was also quite interested, so my research is about fostering relationships, and I think where fostering relationships sit is a very interesting place because they can be considered developmental relationships because they are between a child and a caregiver. However, lots of epistemic trust theory focuses on infancy and very early developmental life, whereas lots of children come into foster care maybe in middle childhood and adolescence, and therefore the developmental nature of their relationship with their foster carer might be really quite different. Got the word theoretical there, that's a typo. That's meant to say therapeutic, because often fostering relationships are thought to be therapeutic. They're a chance for children to rewrite internal working models, form new secure attachments to caregivers. However, foster carers aren't therapists. They don't work necessarily, well, it's very rare for them to work within a cohesive theoretical framework. Often training is non-specialist, and so they wouldn't be using the same models that, for example, a psychotherapist would use. And while there are some papers written about epistemic trust in a psychotherapy context, fostering relationships aren't psychotherapy. So in a way, I think fostering relationships are a chance to understand how does recovery happen just naturally in the social world. We know lots of people spontaneously recover from often severe mental health difficulties, even without treatment. And we don't really understand very much about how that happens, but maybe fostering relationships just happen to be a strange little scenario in which we can look at that. And of course, I believe them to be extremely important because these are some children who've had a really tough start in life, and this is a chance for them to have a maybe different experience. And so they're important, not just theoretically, but in reality. And I won't go into it any further, but Asa mentioned state and trait, how if we're trying to shift young people's experiences, how do we move from being in a state of mistrust or credulity to having those little states or moments of epistemic trust, to that transforming into more of a trait which might allow epistemic trust to develop. I'm going to ask Asa if you could skip the next slide and just go to the last one. You'll never know what these animations are about. No, you will. If you read the paper, it's all in there. But yeah, so I guess just some questions which Asa has mentioned as well. But I found it interesting in this study that epistemic trust did seem to be important, and in lots of ways, the theory had good explanatory value, even in this one very specific dyad of one foster carer and one young person. But if you ask them what was most important, they would say it's about, well, when you talk to them about trust, they said to trust someone is like to be able to rely on them and to know that they're there when you need them the most, and like they're there for support. And that's not really epistemic trust, that's attachment, or having that sort of availability of an attachment figure. And so actually, if you ask young people and foster carers, sometimes often epistemic trust is not top of their list. And what does that mean? Like, how do those things sit alongside? Does this come first, then epistemic trust? They described epistemic trust as trust on hard mode. It's something which needs granulation. And the last two are just how appropriate is epistemic trust for young people still living in adverse environments or in adolescence when you're trying to work out things independently? Should adolescents really be taking on knowledge in a deferential way, which is how epistemic trust is described, or should they really be testing things out for themselves and exploring that? So is there actually a different kind of trust which is appropriate in different developmental stages? So on that sort of teaser of that paper, I'm just going to leave it there and pass on to Asa. I think it's you next, is it?
Fantastic. Thank you very much, Eva. So my work I would describe it as standing on the shoulders of Eva. Not in a, I mean, obviously, like it's very strange to then look at the next topic to be almost exactly the same. So really, I had a Teams call with Eva last year. She was within her PhD, and I was pre my PhD. I'm in my first year now, and I had a really interesting conversation with her about the importance of epistemic trust in foster care relationships. And here I am now. And I've developed this real interest in how do we take these concepts and without making them rigorously psychometric, how do we start to look for indicators or ways of assessing or measuring, ways that ultimately you can begin to come up with an assessment method without relying on a self-report 20-question questionnaire and hoping that people have the insight to describe their own beliefs about the trustworthiness of their social world. And I was particularly interested in foster care relationships for many of the reasons that Eva described, but particularly for me, thinking from a developmental trauma lens and perspective, that many children in those foster care relationships have experienced very adverse relational experiences and are in a new kind of relationship which has that therapeutic potential, but like Eva says, often is not a designated therapeutic relationship. It's almost a new therapeutic environment where the opportunity for positive change exists, but is far from guaranteed, and often is not measured. So it's a potential opportunity to have a way of understanding what's going on in that process of change for young people. Just as Elizabeth was highlighting, we have some really fantastic data about processes of change in psychotherapy. But I think it's really important to start thinking about what processes of change are happening during middle childhood, that crucial bit between attachment and adult mental health difficulty that often gets blurred and almost ignored in the literature. So I think it's a really important area to consider. That's my defense of my own PhD topic. So here are my kind of main approaches that I want to take across the course of my project. And I'm kind of seeing epistemic trust from a breadth of perspective. So instead of choosing one modality or methodology, I'm trying to approach it from a few different angles. So the first one is phenomenological. Again, you might say, well, I thought that was what Eva was doing, and maybe it is. But on top of what Eva's doing, which was a case study design, I'm really interested in the way that young people make sense of that experience. So I'm trying to come up with questions which have that element of interpretation. So not just, did it matter, but why did it matter? In what ways did it matter? What did it mean to you to be able to come to trust information from your foster carer who you didn't initially? Or which experiences really promoted that sense for you that you could rely on information from your foster carer? And likewise, I'm especially interested in the opposite dynamic. And I think this is something that's really pertinent to psychotherapy. Where is it the case that foster carers feel they're able to trust information from the child in their care? How trustworthy do foster carers think the child in their care is? And what promotes that? What experiences can a foster carer have, which makes them think that that communication is a really strong bond? And all of this really depends on how you define information or knowledge. And it's all about trust in knowledge or information from the social world. But I think there's a huge amount of space within the concept of epistemic trust for trust in the information that's being transmitted about affective information, affective communication. And you're still trusting a form of information or knowledge from the social world when someone says, I care about you. And whether you believe that is an authentic, generalizable, and relevant piece of information is a hugely important issue, I think, especially with children who are in care. So that's the kind of first part of what I want to look at. And the second part is using observational methods. So I'm really struck by the way that in mentalization theory, we were working in that field for a good 15 or 20 years before the concept of embodied mentalization became kind of commonplace and people started using it more frequently to describe an interactive relational process that produces states of mentalization, and the capacity to mentalize can be behaviorally examined. So the second part of the project that I want to explore will look at embodied epistemic trust. And I think it relates to a whole load of other processes. And I'm not too focused on trying to isolate things that can only mean epistemic trust. I'm more interested in examining those indicative behaviors, which I think will have a combination of the way that any information is responded to every time something is communicated. And that could be non-verbal or verbal communication. It could be about body positioning within the room. And I think those ways of thinking about that relational dynamic, which is clearly so important from a therapeutic perspective, but also from a parenting perspective, I think that's going to be a really interesting area to see how is it that a foster carer interacts with a young person? How does a young person show the foster carer that they're feeling mistrustful or trustful? And I think those are going to be hopefully really interesting ways of starting to operationalize the physicality, the embodiment of epistemic trust. And then the third layer to this frankly excessive cake is the representational layer. So I'm interested in at what point does epistemic trust not just become something we experience in the moment, not even become something that we're consciously expecting from relationships, but what about the level where we have a model of relationships in our mind, and the fact that people are epistemically trustworthy might be a feature of that. And for children, it's obviously incredibly difficult to access that representational level directly, but we do have the opportunity to access it through play-based methodologies. So I'm intending to develop a new story as part of the StoryStem assessment profile, which asks a child to complete a story that you tell the first part of and has a dilemma in it relating to a relationship. And the child tells the rest of the story. And it reveals a bit about their attachment expectations, their mentalization capacity, but also, I think, potentially their epistemic stance, that perspective that the child takes on whether a caregiver would be trustworthy in a situation, whether a child would take on board the information that a caregiver communicates to them. And so at that kind of abstract level, it might allow us to assess epistemic trust indirectly, rather than creating a kind of experimental condition where we manipulate a child's level of trust or trustworthiness, but instead to look at the stories that children tell themselves about what it means to have a caregiving person in your life. And I think that could be a really useful way of starting to standardize how we measure epistemic trust for children at that middle childhood stage, and also potentially enable us to explore change longitudinally in a more meaningful way with looked after children, which is obviously a hugely important issue when we're trying to figure out how to strengthen those relationships, especially if epistemic trust is increasingly found to be a really useful mechanism to understand that. And all of that I want to try to contextualize with those real clinical implications. Obviously, developing a measure has that natural implication that you're ideally going to make something that's useful. And I would like this to be a useful thing, both for psychotherapists to understand something about the child's internal world, why trust matters to a child, but also how trust impacts their internal working model of the world. But also that it will have some theoretical implications, because there have been a lot of hypotheses connected to the idea of epistemic trust at this point. And this is one way to start to examine how accurate those hypotheses are, to start to test them and to start to explore if the associations between aspects of epistemic trust and, for example, early adversity are borne out in reality for children in that period of their lives. So that's the kind of broad scope of my project. And I think we'll move on to Jerry's project, which is a little bit different and a little bit more related to the kind of systemic way of thinking. I'll pass over now.
Thank you, Asa. And just to say, there are two other DPhil students in the Department of Social Policy and Intervention at Oxford who are either directly or indirectly working on projects involving mentalization. Ana Fernandez in particular is conducting an effectiveness study looking at an intervention in perinatal period. And Susan Swingler is working on a large RCT, I think, of the circle of security. My focus hopefully will be on the role and mechanism of epistemic trust in reducing risk of maltreatment in parents undergoing the Lighthouse NBT program. Asa, if you go to the next slide, thanks. Currently, I think the first paper I'll be attempting will be looking at, and I'm grateful to Elizabeth, a conversation with Elizabeth Lee in relation to this, some clarification and homing in on this, but essentially looking at the therapeutic alliance, working alliance, perhaps other measures of psychotherapy process. We'll be looking at goal-corrected empathic attunement done by Una McCluskey, for instance, seeing if it's possible to analyze dimensions as measured by these and map against current measures of epistemic trust. And assuming that goes reasonably well, next slide, please. Thanks, Asa. There is a current randomized control trial underway. Nick Midgley and Michelle Sleed are leading on the RCT, and it should be possible to look at that data and see if epistemic trust as measured at the end of the program is associated with outcomes in reduction of risk as measured by the child abuse potential inventory and social care status. It might be possible to see if epistemic trust mediates these outcomes. And I'm wanting to do an analysis of the individual and group sessions that the facilitators are conducting. They'll be videoed, they are being videoed, and it should be possible to analyze these using the patient attachment coding system, Alessandro Taglia's, and his therapist attunement scale. And hopefully through this we'll add something into the mix and shed light again on the mechanism of the establishment of epistemic trust in those parents in whom it was successfully established, or with whom it was successfully established. Okay, and then last slide. Thanks, Asa. And then I'm hoping, and I'm grateful to Nick Midgley for suggesting the interpersonal process recall methodology. But at conclusion of the RCT, I want to do a propulsive sampling of maybe 14 parents who've completed the program, 7 perhaps with low epistemic trust, 7 with high epistemic trust, as judged by the facilitators and supervisors. The methodology itself necessitates it being implemented quite close to the experience of the program, and therefore we probably won't have the objective measures of epistemic trust using the ETMCQ. So we'll rely on these judgments. And I hope to conduct qualitative interviews using the interpersonal process recall and conduct a thematic and then a conversation analysis. All this feels rather sketchy at this stage because I'm very much early on in this and also part-time. Okay, thank you.
Thank you very much, Jerry. So that's our 4 projects at this stage. As you can see, at kind of different levels of conclusion. But so we've got a bit of time now before we move on to smaller groups where we can think about your own perspectives on the topic and any areas of particular interest that you want to raise or any thoughts that you've had so far. But I just wanted to have a bit of time whilst we're still a larger group for a kind of general Q&A. If there are questions about individuals' projects, you want some clarification. Like I say, it has obviously had to be a very fast-paced session to get through all the material that we have. And we're all very keen to be in touch with anyone who's interested in this topic area. So definitely do get in touch if you've got any questions that you'd like to share later. But I just wanted to open up to the floor for a couple of minutes to see if there were any general questions.
I'll just unmute myself. Hi, I'm Jordan. I had a quick question for Elizabeth. I just wanted to clarify. In your study, are you looking at those indicators on an interview or on sessions themselves?
So I know it's quite confusing. So the RCT is psychotherapy session, and nested with that, Nick Midgley, he's also my supervisor, he's also here. He had a Impact Me interview project going along with this. So it's the same group of depressed adolescents. So at the meantime, they had received the interview from baseline at the end of treatment and 1 year follow-up, so 3 time points. So identifying those who entered treatment with indications of epistemic mistrust from the interviews. So those quotes that you saw are from the interviews. And then I go into their psychotherapy sessions to see what is going on. So I hope I've answered your question.
Yes, and that was exactly what I wanted to clarify, but it was both. Cool, thanks.
Thank you.
Got any other questions before we go for a bit of time in some breakout rooms where we can share some ideas around some more specific questions?
I will raise another question that I would be curious to know people's thoughts about, or I have 2 questions, and I guess you can decide if they should be put out now or later. The first question that was in my mind was the idea of the foster carers, their trust in the child. I was also thinking about therapists trust, like we often think about the patient's epistemic trust, but the therapist's epistemic trust with the patient. And I think especially, you know, with patients with personality disorders, the therapist side and trusting the patient and their reports of things. I guess that was my first question. Then the other question was in these, with the exception of focusing on adolescents, I was also just curious to hear more about thoughts about assessments with children. I know you talked about it a little with the story stems, but thinking developmentally about, you know, in what ways to look at epistemic trust between infancy and adolescence. More about that.
Jerry, do you want to field?
Yeah, no, thank you. Just on your first question, if I may, and again, Asa, you very much are focusing on this as well. From my clinical work, one of the things that struck me is that certainly parents cite the moment that I demonstrated trust in their testimony, their account, or their narrative as pivotal in their reciprocating trust. And I think that's yeah, vitally important, and certainly will be part of what I'll be exploring in the qualitative interviews as will Asa.
Yeah, definitely to add on to that, I think there's something really interesting about what we mean by trust, and again, compared to what we mean by credulity. And I don't think that very many clients in a therapeutic context would find it easy to trust a therapist who seemed to believe whatever they said, who they could get away with whatever lies they want to tell or whatever truths they want to tell. It doesn't really matter to the therapist, they're just taking it all on. And there's actually, I think it's where this idea comes from is from the clinical thinking of the likes of Peter Fonagy, where it's really an observation that in those relationships where therapeutic change does happen, there does seem to be that dynamic where both participants feel able to be open to trusting information that's communicated. And that doesn't mean not to be vigilant about the quality of that information or aware of contradictions in that information. But it does mean having the ability to not assume that someone's going to be lying, not assume that someone's going to be untrustworthy. And I think in some ways, I'm very interested in the relationship between trust and hope. And I really like the idea that trust is such a future-oriented perspective, which is there is a hopefulness that the person is communicating something that is useful and relevant. You haven't been proven either way. So you're in suspension when you're in a state of trust. You're hoping that your trust is going to be well placed. And I'm really interested in the idea of, instead of epistemic mistrust, almost thinking of epistemic despair, like that belief that you can't trust anything and you're at a loss. And I think that really translates neatly into the more emotionally charged therapeutic kind of setting, where someone might really experience a state of despair, and what therapy can reopen is that trusting capacity for hope, which is literally just a theory that I've come up with in my first 6 months of a PhD, so I wouldn't rely on it. But I think there's a real connection there that I think is important to think about. Eva, do you want to?
Just also, I'm wondering, Jordan, if you had in mind when you asked these two questions that there's almost, I think there's a developmental link, but there's a link between these two questions in that I think the interpersonal, like both ways, nature of epistemic trust also might play out differently at different developmental stages. It could be that in infancy there is more of a role of the child as kind of absorbing the information from the caregiver, and there might be over time an increasing need for young people to be seen as a reliable source of information themselves, or the way in which they're seen as a source of information might become sort of increasing, might vary. So as an infant, it's important that your sort of cries are felt to be meaningful and that they mean something. We're trying to work out what that is, but the trust that they have meaning, and they're not sort of, as you would see, very low mentalizing caregivers saying, oh no, they're just doing it to annoy me kind of thing, that there is something behind that upset. But then later in life, in adolescence and middle childhood, it's a different way in which children might need to be seen as a source of reliable knowledge and interesting kind of a source of social learning, I guess, and the way in which they engage is different. And I do think this is an area which we all kind of need to think about a bit more carefully, is how do we granulate that developmental line? Like, it's not the same thing which is going to cue epistemic trust in infant as an adolescence. And also it's probably not appropriate for a 5-year-old to show the same trust of a caregiver and their views as a 17-year-old. That would be quite strange. And so I do think that's an area which we need to kind of work on, and also need to be really mindful of the fact that trust is not always appropriate. And even people who are sort of identified as an expert or a trusting figure, often when we look back on, you know, historical events and stuff, we think, why did we trust that person, even if they had all these cues of being an expert and someone to trust? And so sometimes mistrust or cynicism is really valuable. And how do we teach that appropriately? So I think it's those areas where hopefully people are going to come in and make further developments.
I was just going to add in on the measurement perspective. I think I like thinking of epistemic trust as a very closely connected concept to attachment and mentalization. And I think it makes sense to think about the ways that we've started to conceptualize measurement of those constructs alongside the measurement of epistemic trust. And so I think, obviously, we have a tendency broadly to come up with very elaborate concepts, which often have aspects of the complex unconscious mind involved. And then we do a self-report questionnaire and call it a day. And then we reduce that one down to an even shorter self-report questionnaire. So there's a risk of oversimplification for the sake of making this a manageable concept to measure. But I actually think a large part of the utility of this kind of concept is going to be in the kind of reflectiveness it encourages in a clinician, because it brings us back to the quality of your relationship to that individual person and the state that that person might be in, the stance that they might have towards the social world. So it's not necessarily the case that it has to be subject to rigorous psychometric outcome measures. It potentially can serve a purpose as a broader explanatory concept, which is clinically very useful, without having to be the be all and end all of measurement in clinical kind of settings. Yeah, Sybil.
perhaps following that, I find it extremely creative to measure epistemic trust using story stems, and I'm very intrigued by it. I'm just wondering, in adding another story is a very interesting idea, and I would be very curious to know what kind of a story. But what about, indicators that are already in the story stems themselves that we could use to code epistemic trust? I don't know how you would find that idea, like whether, in certain stories that where the child needs help, does the child approach the caregiver? Can they use the information the caregiver gives? Do they reject it? Do you think there could be codes added to the story stems to capture epistemic trust in middle childhood? Because I also agree there is a huge measurement gap in middle childhood, and a self-report measure won't do. So a representational measure, play-based, is a fantastic idea for this.
I definitely think you're right that there is plenty of room within the existing stories. What has been the case generally, the way the story stems tend to be structured, is that each story elicits a kind of predominant code, but then that the same codes might feature in a less emphatic way in other stories. So for example, there's a story which is specifically the one that kind of reveals the most about a child's mentalizing stance. There are still subcodes in other stories. So I'm very much looking to explore the stories that already are part of that procedure, and to think about what indicators might suggest a stance of epistemic trust. And it's quite difficult as well to establish, especially that transition from a mental states perspective, trust to experience trust, to a representational performance or a playing out of trust, especially when some of the concepts related to trust are really closely related even to just attention, like receptiveness, openness. There are lots of other terms we could use where there's less at stake, whereas a sense of trust does imply a degree of almost vulnerability if you accept information from the social world. There are lots of almost synonymous terms that might explain a similar kind of receptiveness to information, but a different kind of information or a different reason for accepting that information. Because obviously I think we need to remember that epistemic trust really does just refer to that kind of receptiveness that is without independent evidence of verification. So like, if you are told something that you know cannot be true, like in your hand there is a guitar and there isn't a guitar, it's not trust or mistrust to ignore that, it's knowing what's in your own hands. So there's a kind of empiricism that we've got to separate from trust. Like trust can only be when we don't know for sure either way. And that's quite difficult to drill down into how that would look in a play-based situation. But I definitely will be very open to hearing ideas and thoughts about what kinds of indicators we might get from a representational measure, and including from the stories that are already in that procedure. I'm definitely aiming to kind of draw out some codes from that. So I think inevitably and traditionally, when I announced there would be breakout rooms, I think about half of the people here left. So what we could do is instead of doing a full breakout room, we could just think out some of these questions and just open these issues up to people who've been listening. If there are, I think probably particularly those ones that address the role of epistemic trust in the psychotherapeutic settings. I know we talked a lot about in the childhood setting because of Eva and I's area of interest. We talked a bit about looked after children specifically, but it might be interesting to hear other people's perspectives on the role that they think epistemic trust or mistrust or credulity might play in the psychotherapeutic context, or how it aligns with the work that you're doing. It'd be really interesting to hear some other perspectives on that.
Well, hello. I would like to make a question. I don't, but I don't know if it's pertinent. You tell me, please, because I on my internship I have a patient, an adolescent, and he lies a lot, and I know he's lying because of the narrative he uses sometimes don't make sense, the body language, and also because of other sources of information about him. So what would be a good feedback? Because I don't know if he has a trust or mistrust, epistemic trust or mistrust or credulity, but I think it's nevertheless is important to give a feedback. Like you was as talking right now. So what would be a good feedback to give this kid about about me mistrusting him?
I wouldn't want to give a specific clinical answer, but
Right.
I think something that's quite interesting to think about, and I think that's a good example, is the relationship between trusting and being trustworthy. And I think something that is communicated by people who are not trusting others is that they don't think others are trustworthy. So if someone is lying, I would imagine that there is something about the way that they think of that relationship, which means they don't think, they don't think that you could trust them because they're lying to you. So they're obviously aware that whether they're telling the truth or not. And they probably also don't feel like they can rely on information that you're communicating to them. So I think there's a kind of connectedness there. I don't want to be giving specific advice, but I think there's an interesting thing to think about with these concepts where there's something being communicated by indicators of mistrust. And that could be an area to explore, that maybe what they're communicating is that they're finding it hard to trust you, or that they think you're finding it hard to trust them. And I think that could be an interesting thing to explore, without being a recommendation to explore it.
Okay,
I don't
thank
know
you.
if anyone else has other perspectives to add as well. Yeah, Jordan.
Well, I saw Elizabeth had her hand up first, and then I'll go.
Jordan, you go first. I will go after you.
I was gonna, one of the things that I was thinking about was this in context of object relations, because I also recently, I'm trained in transference focused psychotherapy too. And I was thinking about the idea of like trust and mistrust as so in object relations and in TFP, you work with like the dyads and it switches. So the patient can feel like you're not trusting, you're not trusting me, and like who's not trusting who can shift back and forth. And I think those shifts also might be an interesting thing at some point for everyone to look at in therapy, how those shifts in the dyads happen. And because I think what Francisco you're describing is, and I was going to say exactly the same thing as Isa, that the experience of you can't trust the patient, and the patient is probably unconsciously or consciously communicating he can't trust you. But like where that trust and mistrust lies, I had a patient where she, her experience of the relationship was that she couldn't trust me, but at the same time, she was the one who had lied to me in therapy about something, or like, hidden something in therapy, kept something important secret in the therapy. And so at the same time in the object, in the object relations dyad, it was like, well, wait a second. I was sitting there trying to convince her she could trust me. And then I was like, wait a second, I'm not able to trust, like I'm the one that, is also not able to trust her. And so I don't really have an answer other than that. I think thinking about it from an object relations perspectives and two sides of a dyad that can shift in a therapy can also be a useful framework, and not in opposition to attachment.
I think I can sort of answer the question in a theoretical way, but maybe not in a clinical way. Maybe Jerry will be better with that. So I have 2 points I want to make. The first is we must distinguish between epistemic trust and the sort of thing we call like trust. I think that's more interpersonal trust built between like two people or building relationships. So epistemic trust, I know it's hard to understand the word epistemic. Think of it as pervasive mistrust. So I do not trust any knowledge, information communicated via interpersonal relationships. So it's not I don't trust you or you don't trust me. It's I do not accept new information from the world. So that's like kind of a core feature for psychopathology. That's the first thing. So I think the sort of the kind of trust between therapist and patient, that's more about the poor working relationship. How can it be? Well, there will be ruptures. How you repair it to, go back to a collaborative working relationship. I think Jerry would have more to say about that. The second point I want to make is I think I can kind of theoretically answer your question is Fonagy in 2019, he published a paper, and also before that, he has proposed 3 stages to build epistemic trust. And the first stage is epistemic match, which is a match between a therapist and the patient, that the patient understands the therapist can view things from their perspective. So if the patient is lying to you and other things, he or she may not have this faith that you can take their perspective. So there's mismatch. I would say the mismatch is a core feature of this, not trusting each other's relationship. Then they will have increased mentalizing, then later reappearance, re-emerged social learning capacity, which is epistemic trust. But then I believe there are studies going on, and there'll be more publications near like maybe 2 or 3 years about therapeutic relationships, like collaborative working relationship, those topics with epistemic trust. So I think Eva and Katie, I think Eva put hands up right after me, then Katie. Yeah.
Hi. Yeah, sorry, something's gone with my internet, so I'm now joining from my phone. Yes, it's such an interesting, sorry if I repeat anything you've said, Elizabeth, my connection went a little bit, but it's such an interesting question, and it does remind me of in the first study of my PhD, just it feels very resonant, something that came up with a young person sort of explicitly spoke about kind of what Jordan and Elizabeth and AC you've been talking about the idea of a young person said, well, after so many relationships where I didn't feel that I could trust people and I didn't feel that they would trust me, I thought, why make an effort? Like, you just become an untrustworthy person because no one trusts you and no one is behaving in a trustworthy way. So they said, well, what's the point in being trustworthy? I just won't be anymore, and we'll see if anyone cares. And I found that quite sad, but also interesting that it's almost like leaving out that untrustworthiness and not sharing things, or sharing things which are untrue, to see, is anyone going to pick up on that, or to as an almost something to do with the perception of the self, and thinking, I'm actually not that trustworthy person anymore because of the way that I've been treated in previous relationships. So yeah, I thought that was an interesting thing, and also very profound that young person was able to kind of reflect on that as well.
Fantastic. And I think Katie was next in line.
Hello, sorry, I joined a little bit late. I'm Katie. I work in a parent infant service in Greater Manchester in the UK. So I'm not really sure what my question is, but it was just an observation really about how this concept links with confused states of mind. So I suppose I was thinking that if you don't know what you know, if if you can't trust what you know or what or who somebody is, and you can't trust your own mind because your mind is fragmented, or you have you're confused. How do you sort out what is, is that part of a difficulty with epistemic trust, or are they separate things, or what are the links between those ideas?
I think that's a really, really interesting issue. And I think that notion of self-trust, I think so much of this theory is so closely related to theories of the emergence of self, related to theories of affect regulation, related to who we are when we become people. So they're not small questions, but I do think that relationship between epistemic mistrust or credulity and the inability to have that kind of executive ability to discriminate between information, to have that confidence that your own perspective has a meaning as a category. I think it's a really interesting issue. I don't think there is a resolution. I'm not even sure there's been one that's been explicitly described yet. But I do think it's a really key concept, because we have a very clear sense of almost a very solid dyad between two specific entities. But when one entity has so much doubt in what it consists of, it's very hard then to see how that bond could be of benefit to a person who doesn't feel like they have that kind of integrity of their own self. So I think it's a really, really interesting point to think about. No, that's really not a very effective answer. I wondered, Jerry, if you had any thoughts on that. I know you've had other comments to make as well.
Yeah, I wonder if I can link both. I'm just aware that I think more as a clinician than as a researcher. So yeah, so just to highlight that. So apologies if this is too clinically focused, but I wonder, Francisco, whether you would consider saying something like the following to the young person, which would be, let me tell you where I'm at. I want to take a risk here at trusting you with something that's about where I'm at right now. And that is that I'm not sure sometimes whether I can believe what you're saying to me. And the reason I think this is linked with Katie's question about confusional states is that, again, clinically, in my experience, when the therapist or the one part of the dyad makes a clear statement about where they are, it can be at least grounding for the very confused, distressed, overwhelmed, traumatized individual to almost be able to navigate something of their lostness against the solidity of the therapist, as long as what you say is true and congruent to everything else you're communicating at that moment. So it must be a statement of fact about an emotional state that's likely to be experienced as congruent with your embodied mentalizing. But I'm aware that's a very clinical answer. I'll take my hand down now. Thank you.
Eva, I can see your hands up.
Yeah, I just thinking about your question, Katie, I think it really links as well to mentalization theory, doesn't it? And the link between mentalization and the development of self. That, you know, as infants, we don't know what all these feelings are internally, and we don't know how to interpret them and what they mean. And it's really through caregivers mentalizing that we're able to put names to those, to understand what they mean, how to address those internal states, how to regulate, how to identify different feelings and thoughts. And if we are in a state of epistemic mistrust, then we're not able to make use of mentalization. And that's something which, yeah, unfortunately with some of the young people I've spoken to, that they're really in a moment where even if a foster carer is really quite sophisticated in their mentalizing, that young person cannot make use of it because it's scary. It feels, they find it hard to match up to their internal feelings, and it's something which they're defending against. And then that creates further confusion because they're not able to make use of that social world to understand their internal world. And it does create a bit of a vicious cycle, but on the other hand can create a virtuous cycle where if you socially learn from someone else who's mentalizing you pretty well, that can allow you to organize yourself a little bit. Then you might trust them a little bit more because what they said made sense and explained what was going on for you. And then they can mentalize you a bit better, and it creates a bit of a cycle. So I think it's so linked. Like I totally agree with what you're saying, that those things do seem really bound up together.
One thing that made me think of was, I think we've looked at lots of extensions of the concept, lots of different approaches to understanding the idea of epistemic trust. Something that I think is slightly missing still is the more systemic approach, which says how trustworthy is the social world that you're in, how trustworthy is the network of information that you're exposed to. And I think there are lots of scenarios where epistemic trust is at very least boundaried within the trustworthiness of the system that you're in. I think that's really apparent when you're working in the social care system, which is often a very untrustworthy system. It's very hard to trust people in that system who you only know as agents of that system. But likewise, it might be very hard to develop trust if your family system is still pervasively untrustworthy. And I think that's a really important thing when we're starting to think about clinical applications, is how you dismantle untrustworthy systems and rebuild trust into them when they aren't just held in one person's mind or another person's mind, but there's a more systemic issue. And I think that will be a really interesting area where this concept could be expanded into. Again, it's more like it's a direction for future consideration.
Well, Asa, I have an example also for that. So I think so. One time, a patient, he said he wouldn't be able to interact on the street with someone in a party or something like that. And we made a role play where he would have to ask me some information about a product in a shop. And maybe he couldn't also trust me, but he had the difficulty of like 20 minutes just for start talking. He couldn't look me in the make eye contact, and also his body was not on my direction. So maybe that's a clinical example.
Sounds really relevant. I think it's really interesting when we think of the examples of the ostensive cues. We talked about them very briefly, but those triggers that enable someone to receive information from the social world. The examples that are used are often related to like very early childhood. Like we say, like using like baby talk, or having a really responsive face, or using the baby's name. But we don't think so much about in our day-to-day lives, what kind, or in our adult lives at least, what ostensive cues most effectively like open us to information. And I think it can be really interesting because eye contact is such a consistent feature of those kinds of mentalizing stances. I think it's a really relevant concept to think about how do we as clinicians, as people working in the psychotherapy world, how do we create an open stance? How do we enable both mentalizing but also epistemic trust? And they have a complicated, probably circular relationship, that the more that you develop that trust, the more able to mentalize each other you are, and onwards and upwards. But I think that's a really good example, really interesting that eye contact was a major thing that you noticed almost intuitively as an indicator of mistrust. I think it's very common to see things in that way. Yeah. Do we have any other questions or comments? I'm aware that we've reached the end of our allotted time. If there's not anything else, then it was really lovely to meet many of you to discuss some of this stuff. I think it's always really amazing when you feel like you're in an area of work to be able to connect with people who are really interested in that area and can produce some really constructive and interesting, insightful conversations. So I've really enjoyed that very much. I'm very grateful for you for all of your time and your contributions.
And I would like to thank you, Asa, Jerry, Elizabeth, who had to leave, and Eva, for generously sharing your work with us, for discussing all these different aspects of epistemic trust. And these are all questions that the field is struggling with. So the purpose wasn't to find answers, but to find creative ways of thinking about the concept. So thank you, everyone. This was mind-opening.
Thank you.
Thank you very much.
Thank you.
Brilliant.
Bye.
Especially Sybil, thank you.
Thank
See you
you.
soon. Thank you.